our next guests join us to talk about the Health Data Research UK's Black Internship Programme launching this Friday, 1st of July. Joining us via video call is Professor Martin Levermore, the CEO of Medical Devices Technology International.
Now we also have intern Mbasan Jallow, who's a health psychologist and researcher currently completing her doctorate in health psychology and has a keen interest in the impact of psychological, behavioural and social factors on health. A very warm welcome to you both. Assalamu alaikum, Mbasan. Welcome, Professor.
Welcome. Thank you very much for having me.
Thank you for joining us. Professor Martin, how long has this scheme been running at HDR UK and who's it in partnership with?
The actual Black Internship Scheme this is actually its second year of operation. It was felt when looking at the underrepresentation of Black individuals within the areas of science, technology, engineering and maths, that for us to get a better understanding, a view of cultural diversity, that it was a certainty that we needed to have this program. To that extent, there have been a significant number of partners working with HDR UK, the likes of Guy's and St Thomas, the Royal Wolverhampton Hospital Trust, a number of cancer research organisations, and the Rosalind laboratories. So it's a bit of a wide, broad mix, collective mix, of those that have pioneered or forefronted this new area of health data science.
Interesting,
Amazing.
interesting. So before we bring Bassam in to this conversation, I'm intrigued by health data that this program is involved in. Why do we need health data? What is it used for, Professor?
Well, health data in itself is about looking at personalised healthcare and trying to also get greater efficiencies in order to improve patients' outcomes. What we've known through our entire journey of looking at the different pathologies is so often we are duplicating effort in trying to improve patients' information. And even if we just look at the areas of cancer, the fact that if we are not being able to be informed by the data of the individual over time, we can't look at preventative or improved patient pathways. So the value of health data is to bring about a more efficient and improved service through developing and improving patients' lives.
Yeah, that definitely seems very invaluable.
Absolutely, and data really is king, and it really helps to inform where you've come from and where you're going. So on that, I wanted to ask more about the internships. And this is the second year running, but how long do the internships last? Are they paid? Are they in person? Or do you get are you allowing remote and hybrid working?
Well, during the period of COVID, we've had to do this remotely, which has been a challenge in its own way, but has actually been very rewarding in building teams from different areas and coalescing. The length of the internships are approximately 6 weeks, and they are paid internships. And the value of that is also ensuring that everyone sees the value of the individuals in this program. I'm hoping as we move forward that we will have a blended process, both physical and remote, because there is no reason on earth that we can't have collective teams wherever they are in the country or in the world working together to answer the research questions around disease pathology.
So Bassam, right, this program is exciting. It's about to be starting soon. You've applied for it. Yep. You're going to be joining along. Now you have a health psychology doctorate. What enticed you? What inspired you to take up this program?
For a number of reasons, actually, because as you mentioned, my background is in health psychology and behavioural science. So essentially my work experience previously is to do with both in the NHS and social services. So looking at how to improve service users' well-being and promote health. So essentially with health data, it's looking at the same issue but from a different perspective. So I'm quite curious about maths and statistics. So it's not my area, but I've always wanted to know a bit more. So when I saw this opportunity, I thought this is perfect for me, because it's not only about learning, but seeing how it's applied as well. And I'd be working with Genomics England, which is a perfect fit because it's kind of looking at using genome testing in order to improve diagnosing as well as treating certain conditions, and looking at the specific individual. So looking at their genetic makeup and how that can be used to kind of create a personalized treatment plan rather than a generic one. So that's essentially what I aim to do as a health psychologist, looking at the individual and then providing care around them rather than just applying a generic framework.
Really fascinating and so relevant to today's, I mean, like, well, we've just lived through a pandemic and, you know, genome sequencing around conversations about the virus and along the lines of conversations to do with the vaccines were just so prominent, and we were always hearing about it in the news. Very little understanding, and I think this is where, you know, the expertise comes in from you yourself. And, you know, this program is interesting. So it's a 6-week program, and you've just told us what you're hoping to get out of it. What has been your experience with the background you come from, trying to navigate the science world?
Oh, okay. It's been, for me, because speaking from a psychology perspective, it's been quite interesting in that after I graduated from psychology, I decided to go into the NHS, so working as a social therapist within a mental health ward, which was a very rewarding experience because based on that experience, it kind of directed me of where I wanted to go. Because initially I wanted to become a clinical psychologist, but then I realized I was interested in both physical and mental health aspects, hence why I decided to study health psychology instead. And for me, I think one of the biggest challenges was actually seeking out opportunities to kind of gain further skills.
And that's the key part.
Exactly.
And that's what this program is giving a kind of stepping stone towards.
Exactly. So that's why I very much appreciate this program, because from the start, from graduating, I always wanted to kind of build that experience in different fields just to see what would be well suited to me. And what I found is that it's easy to go to university to get the knowledge, but what's difficult is actually applying that. And I think this program is perfect for people that you may not even be sure that you want to go into data science, but at least it provides you that opportunity to be immersed in that world, to actually be able to not only develop the skills, but also to see how you can apply it in different settings. So, yeah.
Fantastic. And I'm really, really pleased to know that the schemes like this are available, because as the Professor mentioned, you know, there is, you know, misrepresentation or disrepresentation or underrepresentation of minorities in the sector, especially in STEM. And so being able to give these opportunities is so important. Inshallah, you'll be able to thrive in this experience and then take it further, which is what we're hoping will happen. But how did you feel when you heard that you were the one who was selected? Because I'm sure it was quite competitive for people in applying for those.
Yeah, so initially I got an email from Genomics England, and I was confused because I didn't remember applying to Genomics England itself. I applied to the internship. So at first I just ignored it until I got a phone call from one of the members there. And they basically explained that, okay, it's part of the HDR internship and things like that. But so I agreed to do the interview, but then I did a bit of background research. So I was looking at the website and it was talking about genome sequencing and things like that. And I had no clue about what that was. So initially, I actually sent them an email saying, I don't think this is for me. But alhamdulillah, they kind of called me again and they kind of explained the team that I'll be working with and how relevant it is with my background. And yeah, so after that, I was quite excited because I was like, okay, this is not something I would ordinarily think would be suited to me, but actually there's an opportunity here for me to learn and to apply what I've learned previously to a different setting. So yeah.
Fantastic. So, Professor Martin, we've just been listening to Bassam, a very enthusiastic candidate for the programme, talk about you know, the exciting prospects ahead. Now, you've obviously helped devise this programme. Tell us what what the relationship was like, cultivating it with host organizations to build in, suitable locations to send candidates with?
I think the difficulty at the beginning was to try and have a small cohort so we could test the validity of the program and to ensure the experience both from the host organization and the candidates. What we found from that was the rich context and content of experiences being shared by both, which actually encouraged us to take this year's cohort and obviously looking to move it forward into 2023. The importance of this is bringing to the attention the things we don't know and utilizing our combined assets, those are the organizations and the individual interns, fuse together a relationship that works. And that is not only looking in terms of previous experience, but what value add each brings to the table. And I think from that, we've actually recognized that lots of young ladies have actually excelled, which is highly important, because when we talk about the career opportunities, applying our different skills and experience, there is a tendency to forget the value that young women bring and their understanding within the entire world and the value add in changing the perspectives and changing the scoping of the research questions that we've previously been looking at.
Amazing. I love the fact that it is a mutually beneficial exchange. It's not just the program that is giving to the candidates, but actually the candidates are actually giving back and enhancing the value of the program as well. So it's that exchange is beautiful, alhamdulillah. So how can people find out more about the 2023 program? Because you touched upon that, and obviously Mbasan's now enrolled in the 2022 program, but how can people who are watching find out more about the 2023 program?
I would first direct them to HDR UK's website, which is hdruk.ac.uk, and all the information is available on the website. I would also ask potential interns and also potential organizations to track the experiences of the current interns going through. Their voice will speak volumes of how effective this program is and the beneficial offering, mutual beneficial offering, both to the interns and also to the organizations. So it's a journey, and I think it's a journey that is worth following and seeing the rich context of research papers coming out and fundamentally applied application of the work these interns and their organizations are doing.
And Mbasan, you mentioned how you want to use this program to kind of like explore your own feelings about, the industry, the work. It's almost like you're workshopping the world that you're entering into, which is always a valuable thing to do. But I'm curious, what are your career goals along the way?
For me, being asked about my career goals is always interesting because
I know that's why I prefaced it with, you're still exploring.
Yeah, I think for me, I take it as a lifestyle goal. So my life goals, it kind of merges into one, because for me, I want my life to be I want my work not just to be work, but to be part of my lifestyle. So for me, I want to go into a career, you could say, or a lifestyle in which I'm continually learning. I like exploring new areas. Although my primary interest and love is health psychology, I'm always seeking to kind of go into different fields and see how that can be combined. So this is why I'm quite interested in data science, because looking at like the statistical kind of frameworks that are available to understand how to serve people better in terms of healthcare is something I want to go into. But I'm also interested in mindfulness as well, which is a different approach, but also targeting similar problems. So for me, it's just my life goal is to just be an explorer, you could say. Look at different domains of work as well as life, and just having a balance. That's my life goal and career goal. Balance.
Very good, and spoken like a true health psychologist there. I have to say, there's a lot of zen coming through in all of that, mashallah. But I really hope that we wish you the best in all of that, inshallah. And I do think that definitely trying to take on multiple approaches is always the best way. Like, the more you can fill your toolkit with different experiences and skills, the more transferable they become, and the more that you can apply them in different scenarios and different settings. Eventually, you'll find a place where you're like, this is where I want to cultivate this even further, and then eventually you'll move on, and that's just a life, isn't it? Like you cultivate, you do as much as you can, and once you feel like this is my value added done here, what's the next challenge? Inshallah. Professor, coming back to yourself then, I guess this will be one of the final few questions. What are your long-term ambitions for this program, and where would you like to see minority kind of participation within STEM?
My long-term ambition is to actually see this program rolled out more globally. As mentioned earlier, it's about creating teams with different perspectives, but coming together and focusing down on answering the problem. And I think the more we have an engaged and articulated group, be that Black, be that white, be that Asian, what we start to find is ways of tackling real-life solutions a lot more quicker. We improve the way in which we are trust and confidence patients will have within our healthcare systems. And ultimately, it is about ensuring through programs like this that it creates a stimulus for the next generation to be empowered to do better.
Yeah, that's such a wonderful message to end on. And Bassam, you emulate a lot of those qualities, and so we wish you all the best. And you can only be doing all of us very proud, because you're contributing towards the healthcare future for all of us. So thank you very much. And Professor Martin, thank you very much for joining us on Zoom today. And hopefully
thank you very much indeed.
Hopefully we'll see you all again very soon.
Thank you.
Get a progress update perhaps, inshallah. Thank you so much. Take care, inshallah. And alhamdulillah. Great guest, alhamdulillah. I hope that all of you are watching and feeling inspired, and you're going to be encouraging our future generations to come, inshallah, to also make big strides in this field.